All right, good morning, everybody. Dr. Arafich here from Vet Triage. We are going through the May 15, 2015 edition of JAVMA. Boom, there it is. And today we're going to talk about the What is Your Diagnosis paper here. And so let's get started. They saw a 9-year-old male neutered golden retriever, lethargy, not eating for 3 days. And there was also the presence of an abdominal wall mass on the left side of the abdomen. On physical examination, they found tachycardia, which is a rapid heart rate, and they estimated the dog to be at 5% dehydrated. When they were palpating the abdominal mass, they noticed that it was in the subcutaneous tissues, and it was about 10 centimeters in diameter. The mass was firm, warm, red, superficial bruising, but there was no signs of pain when they palpated the mass. They started with thoracic radiographs, which found microcardia. So microcardia is a small cardiac silhouette that you find on radiographs, and usually indicates hypovolemia in dogs and in cats. So the dog was dehydrated, and they also found faint pulmonary vasculature. That means that the vessels in the lungs were not prominent, and that also is a sign of hypovolemia. On abdominal ultrasound, the mass was located within the subcutaneous tissues. It appeared moderately well demarcated and echogenically complex. So well demarcated means that they can identify the boundaries of the mass, the borders of it, as opposed to something more diffuse that has irregular or ill-defined edges. And when it says echogenically complex, so echogenicity is what the ultrasound machine measures, or rather, that's how we interpret the sound waves coming from the ultrasound probe. And when it says echogenically complex, it means that there's all three echogenicities are located in the structure. So it is hypoechoic, hyperechoic, and anechoic. So hypoechoic means a lower intensity. Hyper is high, and anechoic means it has no real intensity to it. So, for example, something that would be anechoic would be like air, for example. It doesn't have any the sound waves travel right through it. They don't bounce back and hit the probe. Hyperechoic, usually you think of something like inflammation, for example, is really bright, and that or like bladder stones, for example, because the mineral content. And so bone will do this as well. So the sound waves from the ultrasound probe are hitting that structure, bouncing back in the probe, and it looks really intense. And then hypoechoic is less than you'd expect. With it's more of a darker type of appearance to them. So the dog started getting worse over the next 10 hours. They performed abdominal CT or computed tomography, and here is the images for those who want to pause the video and look. And then they have of course a more further explanation, more deep dive into the CT scan right there. And so we'll try to go through it. What they found in the CT scan is they found small foci of gas that were evident throughout the peritoneum. So the peritoneum is the lining of the abdominal cavity, and they found tiny gas pockets in the belly. Normally, you should only see gas within the abdomen inside of organs like stomach, small intestine, large intestine. That's really the only places that should have gas bubbles. It should not be outside of those organs or any other organs that are not gastrointestinal related. They found peritoneal effusion, so there was fluid in the abdomen as well. They saw that the mass was 14.6 by 11.4 by 8.6 centimeters. Very large mass, well demarcated. So that means that we can tell where the boundaries are. Smoothly marginated, so the boundaries of the mass are smooth, as opposed to roughened or irregular. Peripherally contrast enhancing. So when we do a CT scan, sometimes we administer contrast and a contrast agent to the patient. We give it intravenously, and it's supposed to light up. The contrast is supposed to accumulate and light up any areas of the body, organs, whatever, that have an increased vascularity to them. So there's a high blood flow to something like you'd see with tumors or inflammation or infection, then the contrast material will accumulate in that area. So when it says peripherally contrast enhancing, that means that in the periphery of the growth of this mass, the contrast is lighting up. Heterogeneous soft tissue to fluid attenuating mass. So you know how in ultrasound we talk about echogenicity as a unit of measurement. In CT scans, computed tomography, CAT scan, we talk about attenuation. And it's the same principle. It's whether something is bright, dark, or completely black. But heterogeneous soft tissue to fluid attenuating mass means heterogeneous means that it has multiple levels of attenuation within it. So just like how it had a mixed echogenicity to it on ultrasound, this is how you describe it for a CT. And it says soft tissue to fluid attenuating. So you want to compare the attenuation on CT scan to a normal structure. And so we know, roughly speaking, what the soft tissues look like on CT scan. We know approximately what gas looks like, what fluid looks like, and what metal looks like, because of like implants or also in the case of bone, for example. And so this mass was somewhere between a soft tissue attenuation and fluid attenuation. The abdominal subcutaneous fluids on the left side where the mass is located were thickened. They also saw that the right limb of the pancreas was enlarged and its margins were poorly defined. So the pancreas has a mid-body, a left limb, and a right limb. A section of duodenal wall by the pancreas was thickened and as well and enlarged. And there were small punctate mineral to metal attenuations within the stomach in the gastric lumen. So the diagnosis based on these findings is pneumoperitoneum, which is air buildup in the abdominal cavity in the peritoneum, peritonitis, which is inflammation of the abdominal lining, pancreatitis, inflammation of the pancreas, duodenitis, inflammation of the duodenum, and a mass. They suspected a intestinal perforation, and they thought the mass was probably cancer with necrosis, and they thought the two were unrelated. So they went to surgery, exploratory ciliotomy. So ciliotomy is synonymous with laparotomy, which is basically an abdominal surgery of any kind, doesn't matter what the reason is for it. Exploratory means you're going in there to explore. You don't know what you're going to find. You don't know what you're looking for. So it's an exploratory. All abdominal serosal surfaces were inflamed with extensive petechial hemorrhage. Petechia is abnormal bruising, and it can happen from disease, or it can happen because the surgeon is manipulating the organs too roughly. Obviously, in this case, it sounds like the bruising was already there when they entered the abdomen. They found a perforation in the descending duodenum on its mesenteric border. So the mesenteric border is the border of intestine that is pointing inward to the abdominal cavity. It's where the mesentery is attached. The mesentery is what anchors all the small intestines together in the abdomen. So they already move a lot, but so they don't move abnormally and cause problems. The antimesenteric is the other side where it's away from the mesentery. It's the outside part of not the outside part of the intestine, but it's a part of the intestine that is pointing outside of the inner portion of the abdomen. So they found a perforation there, and most often we see perforations on the mesenteric side of the intestines when there's a foreign object that's come through the intestine and then penetrated through, and so that's a very common location, very common pattern. And they also found erosions in the duodenum. So because of the location of the duodenum, they could not perform a resection and anastomosis. That would mean removing the diseased portion of the duodenum and then putting the two other ends of the small intestine together. And so they euthanized the dog on the operating room table. They also did biopsy the mass, and it came back as pyogranulomatous inflammation with granulation tissue, hemorrhage, edema, and fibrin. They didn't find any evidence of cancer, fungal, or bacterial organisms, but the pattern of the inflammation in the mass suggested fungal or bacterial as the inciting cause. So in their comments, they mention here that CT offers the most accurate depiction of the abdominal changes suggestive of gastrointestinal perforation in people. CT provides both spatial and contrast resolution of the abdominal anatomy, which are often obscured by overlying structures with other imaging modalities. Because you might think, well, didn't they perform an abdominal ultrasound? How did they miss this? And yeah, CT offers you a three-dimensional view a cross-sectional view of the organs, whereas ultrasound can't. Ultrasound is subject to the user, the ultrasonographer, as well as the normal and abnormal structures of the body that will obscure or help your viewing of the abdomen, the abdominal organs. In people, the use of abdominal CT provides approximately 86% accuracy in determining the location of a gastrointestinal perforation through the identification of extraluminal air bubbles, which is what this dog had, segmental intestinal wall thickening, which is what this dog had, and focal intestinal wall defects. All three of these things found in this canine. Other imaging modalities that can be used to detect pneumoperitoneum include horizontal beam radiography and abdominal ultrasonography. So I've never performed, or maybe once I performed horizontal beam radiography. The pet is positioned on their left side, and the radiograph is collected in a ventrodorsal projection. So it's an effort to try and have the air lift up towards one side of the body, and hopefully with that ventrodorsal projection, you can catch the air easier to detect pneumoperitoneum. Typical ultrasonographic findings of gastrointestinal perforation include peritoneal fluid, gastrointestinal wall thickening, peritoneal gas, pancreatic changes, and mineralization of the gastric wall. So, and then they finally mention that ultrasonography, small volumes of peritoneal gas may appear as focal reverberation artifacts adjacent to the non-dependent portion of the parietal peritoneum. So they're saying that sometimes you'll see gas in the peritoneum as an artifact because of the positioning of the organs. So that's where they end with this article. So there's a couple of issues I have with this article. Number one, they did mention the metal opacities in the stomach, and they say here in this conclusion that you can see mineralization of the gastric wall, typical of gastrointestinal perforation. So they said in surgery they didn't see perforations of the stomach, but on CT scan you can see there's some sort of metal component in the stomach, and so or mineralization. So I would argue that possibly that may be not necessarily mineralization from chronic inflammation of the stomach, but maybe the dog ate something that was metal in nature, which the majority of it passed through, but some of it perforated the intestines on its way out. So they didn't connect those two things. They also didn't connect how the mass, which was largely inflammation, maybe bacterial in origin, was related to the intestinal perforation or not. I suspect I could argue both ways. Obviously, it may be just bad luck for this dog, affected by both a large inflammatory mass for whatever reason, whether it's something that started off as a bug bite or another foreign body that entered there or whatever. But I could also make the argument that with severe inflammation and infection, which is what intestinal perforation is, that those bacterial organisms that are coming from the foreign body that perforated, that are coming from the intestines, are seeding somewhere else in the body. And sometimes when they seed somewhere else in the body, they call it their home, and then you end up with a massive abscess, granuloma, whatever, in that area. And so obviously this patient was septic based on the description of what they found. It didn't mention here any blood work findings. So that's a bit weird too. And they also didn't mention in here abdominal radiographs, which is usually, especially if it's presenting to the emergency hospital or general practice, ultrasound or radiographs are performed before ultrasound is performed, and certainly before CT is performed. So there's a few things that are missing. I'm surprised that it was published, but they obviously wanted to depict the findings of pneumoperitoneum, which is of course very important because pneumoperitoneum can be easily missed on your standard testing. All right, I hope that helped everybody out there. Thanks for watching in the playback. Thanks for supporting the channel, and I'll see you tomorrow, guys. Bye. 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 Bye.